see my speaking notes? You just
No.
see the slides, right?
We do just the slides. They look great.
Okay, so I'm great. All right,
I'm recording right now.
all right. Got it. Good afternoon, everyone. I'm Dee Clarke. I'm here from the Open Window Hub from the Hazel McCallion Central Library in Mississauga, Ontario, Canada. And I'm here to present what we do at the Open Window Hub to help individuals who are at risk or homeless. So our mission statement is the Open Window Hub is a resource and information center designed to support and empower individuals and families who are unhoused or experience mental health issues within the city of Mississauga. So I have a short video to play.
We can't hear it.
Oh. I'm just going to move on since we can't hear the video. When you share the screen, okay. I will put the link to the video in the chat and then at the end of the presentation, and you'll be able to see it then. I'm just going to continue. So the scope of our service, we engage in relationship with all 18 library branches. We provide crisis prevention and support the library branches. We inform we provide referrals and information. So we don't case manage, but we do provide resource kits out to individuals when they come, and we provide basic needs, hot lunch on Tuesdays and Thursdays, snacks, clothing, and hygiene kits. And why is the resource center important? A resource center collects and organizes materials that are useful to a particular group of people, such as social workers, police officers, crisis workers, teachers. I just have a small testimonial from two individuals that we've helped. And it says, I've learned about the Open Window Hub through our community services within the city, and I'm grateful that I have the support that I'm able to turn to. So the gentleman here, Mike, in the chair, he was homeless for 10 years. And we were able to find him housing, and he's been housed ever since. And Dory came here as a refugee with her husband. And after her husband died, she was homeless for 10 years, and we were able to provide her with housing in a 1-bedroom apartment, and she's been living there ever since. We do support 2 locations. So we've got the Hazel McCallion Central Library with a social worker on site from 9 to 4, Monday to Friday. And then we're also at Port Credit Memorial Arena, which is one of our hotspots. And we're there. I am sorry. So I'm going to try to share again. Hopefully this will work. Just having some technical difficulties here. So I'll just continue. So the Open Window Hub, we've got, I will share some stats with you. So from January to April, we've had 1,314 clients come through the door. We've had 4,022 requests for supports, and supports could be anywhere from hygiene kits to meals, and referrals to regional programs that could be anything from a housing worker to a landlord engagement specialist to street outreach that works out in the community with us. We also have our calendar, a monthly calendar that we put forward to everyone. So on Monday is our mental health day. So we have a RAP wellness and response assistant program that comes on site. On Tuesday, we've got our food programming and we call it our medical day. So on that day, we have Homeless Health Peel, which is the nurse practitioner. So we removed all barriers to care. They don't need to have a health card. They can just come in and see a nurse, and she does anywhere from prescription refills to referrals to detox centers, referring to family doctor. We've got Peel addiction and referral services. We've got CMHA fetal and alcohol clinic, which is groundbreaking for us to have. We've got mental health and justice as well. And we've got Indus, Commissioner of Oath and Settlement Services. On Wednesday, we have Achieve, which is Oath and Settlement Services, and Contact North, which is training and education. And we're also at Port Credit Library. On Thursday, we call it more of our housing day. So we have a housing support worker on site. We also have Service Canada that can get them their social insurance number cards, can get them all other ID, and we have regeneration clinics. So if you're new to the country and you've lost your immigration papers or you've lost your original birth certificate, so you might have come from India or the Philippines, this individual is able to get that back for you as well. And on Friday, we have family services, which is employment and harm reduction. Street outreach we work with, so we are responsible for everything inside the building. Street outreach is responsible for everything outside of the building. And we have workshops, housing and wellness recovery workshops as well. So we do it in small group sessions so people can speak through what it is that they're going through and get the proper counseling as well. Homeless Health Peel, like I said, primarily healthcare, health education, mental health and addiction, personal care. We have our harm reduction van, which is on site with us twice a week. The van is uncovered, so there's no stigma to them going to the van for getting clean needles, injection equipment, naloxone clips, safe injection kits. We also have regeneration, which is the ID clinic. And we know without ID, you can't get income, so you can't get Ontario Works, or you can't get housing, so that regeneration is on site to help us with that as well. And we have our beautiful housing worker. We also partner with Street Outreach, which is a 24/7 mobile van, and they provide mental health support, substance, housing work, emergency shelter, employment. We were groundbreaking this year, so we were able to have the CMHA fetal alcohol diagnostic clinic come on site with us. Really important. So if mother was having a lot of alcohol fluids within her system while she was pregnant, it would then transfer to the infant. So and cognitive delays. So we have that person on site with us once a week. And anybody who's been incarcerated, we've got the mental health and justice system, which will follow them for 2 months, help them navigate the justice system, housing, employment, and everything. And they actually provide case management. We've also partnered with the Mississauga Legal Clinic, the Canadian Dental Health Association. We've had 4C Canada come in and do a vision clinic for us. So anywhere from an eye exam to follow-up treatment, they've been here, and all of the individuals on that team do work pro bono. We have employment services appeal in Service Canada. So another groundbreaking thing that we do in the city of Mississauga is we've got a shower pass program. So the Open Window Hub provides hygiene kits to all 13 locations and towel services to 2 locations. So far this year, we've seen over 5,324 people use our shower program. As I said at the beginning of the presentation, we do have, we provide out resource kits, so general information, information number, crisis numbers, food bank, shelter information. So depending on the need of the client, when they come in and they have that conversation with a social worker, we might be providing them with 3 or 4 different kits at a time for them to navigate through the information and then come back to us if they need any help at all. We've got some really good initiatives coming up as well. So we've got our community barbecue, which is enhancing community cohesion. We work with the Peel Police, so the Divisional Mobilization Unit. We work with the Compass and Street Outreach in the region of Peel. Last year, we had over 450 individuals come to our barbecue. So it's one-stop shopping. The barbecue is not only for the homeless population, it's for the general community, and it's for the other service providers. So it gives them an opportunity to learn about other employment, other agencies within the city that they might not know about. It helps us to problem solve. So it's one day where we start with giving them a haircut, we give them a wonderful meal, and then they're able to get addictions help, mental health help, food bank information. They can get clothing as well. So we just call it our one-stop community day for that day. We also, along with that, we do Cram the Cruiser with Peel Police. So that allows us to go out into the community and ask community members for items that the homeless population are in need of. So we've just done a Cram the Cruiser event last week, and we were able to get toothbrushes, toothpaste, soups, little snacks that we can give out to get care bags. We got towels, body wash. So anything that we can give to the individuals that come through our doors, we've made that happen. Not quite sure if you have any questions for me. Hello? How does the city, country, state government support different? Can talk about. I heard the major Canadian cities that the mayor has much homeless inside your city. Okay, so I can answer that question. So the city of Mississauga, we're a two-tier municipality. So we have the region of Peel that deals with social services, and then we're the city of Mississauga. So the funding comes from the region of Peel for one of our full-time social workers, and they provide a lot of the services that we provide. So the housing worker comes from the region of Peel. The homeless health Peel comes from the region of Peel. And yes, the city of Mississauga, we do provide a lot of the services. So it's almost like they come in, we provide the information and resource, and we pass the baton to a service agent that will then carry them through the rest of the process. I'm not sure if everybody was able to see my slides. Do we have any more questions? I can try and play the video again. I'm going to try this one more time. All right, if anyone, okay, I see another question there. Was from Oshawa, did Google search. Okay, I'm from Mississauga. Oshawa is a different municipality. And I'm not quite sure what is happening in that section. We're governed by different things, and because we are in Mississauga, a lot of the homeless work is not done through the library. It's done through private sector agencies. Okay, so when we have the barbecue, do we block off the whole block and set up booths, or do we do it and around the building? So during COVID, we were very creative. So we actually did it at a church. And yes, we did block off the street and we had all the vendors on the grass. This year we've rented out an entire park. So we've got Pavilion A and Pavilion B. And so we've got an entire park with all 24. Last year we had 24. This year we're up to 35. So we blocked off the entire park. We've got signage from at the top of the roadway all the way down into the park for individuals to know about the barbecue. And what we're also planning, another event that we're planning to do is a community connections fair. So we will have lived experienced individuals. We will have the Divisional Mobilization Unit, Peel Police. We were working with our local college as well for them to come in and speak, social service workers. And we will have a lot of other individuals give their testimony. We'll have the director of the library speak as well. Sorry, and the mayor will come and have a conversation with individuals. Okay, so how did the city and the library initiate all of these organizations? What we did from the very beginning, when we realized that we had a gap in services, we reached out to community agencies and we had conversations with them. And then we kind of explained where the gap in services, and then we started to partner. We also worked with the programming team within the library to bring other partners on board as well. So we've been very successful in being able to leverage a lot of the organization that we actually have on site. We worked with recreation as well, because the recreation team, they provide funding grants of about $1,000 to $2,000 to nonprofit organizations. So we kind of partnered with recreation, with the nonprofit, for them to apply for the grant so that they would have staffing as well, and they would have funds in order to run the program. And in the new Hazel McCallion Central Library, we actually have a community connection.
Here it is. So what you do is you sign up online. Let me see. The website is here, but I can also sign you up now.
Okay, this is such a great idea. I might have to bring this up in the next local advisory council meeting. I think it would be a great way for the services of the community to touch base. Absolutely. A lot of the work we do is community driven. And we really listen to our clients that are coming through the door, where the gap in services are, and we rely on our community agencies to come in and offer that service. So along with programming and with the Open Window Hub, we're able to do a great mesh and have individuals come in. So we even have one-on-one resume help coming through the door. We've got the employment agencies, we've got the settlement agencies coming in, and we've really strived on trying to partner to fill that gap within the community. So it's not just for the homeless population, it's for anybody who's coming through the library. They're able to use these services as well. And it's about fostering those relationships, right? So it's a lot of back and forth, and we brought in programs that didn't really work for the clients that we're using, or didn't work for the community. And it's, just leveling out and working together to make sure it fits the scope of the work that you're really trying to do. I'm just trying to see if I missed any questions. I'm sorry about the slides, but it is in my presentation. The link to that is also there. How did the conversation around the needs start? That started with a lot of, well, the library is the biggest brick and mortar building, and we're open from 9 to 9. And we had a lot of people just coming to the library, disheveled. Library staff really didn't know how to handle it. So it became a need that that was present. And we started, it actually started in recreation, where they started to have the conversation. And then they realized that they needed to bring a social worker on board, and the library took up having the social worker within the site in order to address a lot of those issues. So throughout the year, last year, we did 60 team meetings between recreation and the library, because within the city of Mississauga, we've got different pockets and different needs. And we tailored the team meetings toward what the needs were within those community and brought forward those resources. I will definitely find the video link and share that with you. I'm just gonna get that video link for you right now as well. Not quite sure if there's any more questions for me. Okay, I'm going to share the video link. Thank you for having me. And if you have any questions, you can definitely reach out to me, and I'll be able to provide you with any more information that you need in regards to our program. And like I said, the Open Window Hub is a soft place to land. We remove all barriers to care. Thank you. Bye, everyone.